Any difficulty in study? Relax. The internal Anupam is here. Overview. The basic components of nervous system are the neurons and the supporting connective tissue. Microscopically, the neuron is composed of nerve cell body, axon and dendrite. Anatomically, the nervous system can be broadly classified into central and peripheral nervous system. The central nervous system is constituted by the brain and the spinal cord, while the peripheral nervous system is constituted by the somatic and autonomic nerves. 31 pairs of spinal nerve and 12 pairs of cranial nerve comprise the somatic nerve, while the sympathetic and parasympathetic nerve chain constitute the autonomic nerves. Each and every branch of any nerve processes a specific area of supply and a specific area of representation in the brain. Now go to the introduction. The nervous system is a complex and vital part of the human body that performs the following functions. Those are: 1. Senses the various internal and external stimuli. 2. Integrates or coordinates the various types of the body. 3. Direct individual organ to perform specific function at specific time in response to stimuli. Importance of neuroanatomy in dentistry. Pain control is an essential and primary aspect of patient management in dentistry. Pain control before any dental procedure is achieved by anestheting the nerve of head and neck using the local anesthetic solution. Knowledge of anatomy of nerves and the various structures related to them is very important for practicing different techniques of delivery of local anesthetic solution and achieving site specific action. Components of the nervous system. The nervous system consists of tissue that may be broadly divided into two components. Before I go to the details of components of nervous system, we must know the essential terminology of nerves. One is afferent fibers. Afferent fibers is action that carry impulses towards the central nervous system, also called sensory fibers. Axon. Axon is a long cellular extension of nerve cell body that carries impulses away from the cell body of the neuron, also called the nerve fibers. Dendrite. Dendrite is a short cellular extension of the nerve cell body that conduct impulses towards the cell body of the neuron. Afferent fibers. Actions that carry impulses away from the central nervous system, they are also called motor fibers. Ganglion. A group of neuronal cell body sharing the same function, located outside of the central nervous system. Myelinated nerve. Nerve with a myelin shield called myelinated nerve. Myelin sheath. In an envelope of myelin that helps in rapid conduction of impulse, formed by the membrane of the Schwann cell in the peripheral nervous system and by the oligodendroglia cells in central nervous system. Nerve. Bundle of neuron or nerve fiber called nerve. Nerve tract. Nerve tract is a bundle of myelinated nerve fiber that traverse the brain. Neuron. A basic function unit of nervous system consisting of the nerve cell body with nucleus and cellular extension called dendrite or axons. Non-myelinated nerve. Nerve without a myelin sheath called non-myelinated nerve. Nucleus. A group of neuronal cell bodies sharing the same function located within the central nervous system. Plexus. A group of interconnected nerves or branch or a network of nerves called plexus. Post-ganglionic neuron. Neuron whose cell body lies in the autonomic ganglia and action terminates in the target organ. Preganglionic neuron. Neuron whose cell body lies in the cell and action terminate in a peripheral ganglion by synapsing with another nerve cell located in the same ganglion. Ramas. Small bunch-like structures of nerve extending from a large one. Synapse. Junction between two neurons or between a neurons and a muscles across which nerve impulses are transmitted. Now go to the components of the nervous system. Nervous system consists of tissue that may be broadly divided into two components. One are neurons and others are connective tissue. Neurons. The basic cell of nervous system that receive, transmit and respond to external stimuli. Connective tissue. The tissue that perform supportive function such as providing nutrition and protection to the neurons. They are of two types. One is connective tissue of the central nervous system called neuroglia, and other is the connective tissue of peripheral nervous system consisting the Schwann cell and loose connective tissue. Microanatomy of neurons. Neurons are the fundamental functional unit of nervous system. They conduct electrical impulse to various target organ and communicate with each other through intercellular junction called synapses. The basic structure of a neuron consists of a nerve cell body and cytoplasmic extensions. One is nerve cell body or soma. It is the central part of a neuron which from the gray matters and nuclei in central nervous system and ganglia in peripheral nervous system. Action. Action is a long, single, cylindrical, protoplasmic extension of a neuron which conduct electrical impulses away from nerve cell body. Action communicate with other cell at junction called synapses. Bundles of action from the white matter track in the central nervous system and the nerve in the peripheral nervous system. Dendrite. It is a protoplasmic extension, usually multiple in number, which conduct impulses towards the nerve cell body. Nerves. A nerve defined as a cord-like structures of the peripheral nervous system composed of bundles of action which are covered by connective tissue. A bundle of action called fascicle and bundle of fascicle consists a nerves. Each component of nerve has a connective tissue covering outline or endoneurium, loose connective tissue that surround an action called endoneurium. Perineurium, coarse connective tissue that covers a bundle of action or fibers into fascicles called perineurium. Perilima. Innermost layer of perineurium is perilimma. Next one is epineurium. Epineurium is the connective tissue with the blood vessels that support the fascicles. Epineural sheath, outermost through the fibrous sheet of fiber called epineural sheath. Now go to the types of nerves. The neuron, the nervous system of the body, is categorized on basis of anatomical location, function, control of a system, myelin action, diameter, functional component of nerves. First one, on the basis of anatomical location. Central nervous system, peripheral nervous system. Central nervous system. It envelops the part of nervous system that occupied the central region of the body. It includes the brain and spinal cord. Peripheral nervous system. Peripheral nervous system consists of extension called nerves from central nervous system. They are bundle of action that carry impulse from central nervous system to various part of the body and viscera. The peripheral nervous system is broadly divided into two groups: somatic nervous system and autonomic nervous system, which further subdivide. Somatic nervous system are two types of nerve. One is spinal nerve, 31 pair nerves arising from the spinal cord, and cranial nerve, 12 pair cranial nerve arising from the brain. Autonomic nerves are two types: sympathetic nerve, parasympathetic nerve. On the basis of function, nerves are generally four types. One is sensory or afferent, motor or efferent, mixed or secretomotor nerves. One is sensory or afferent. The nerves carry impulse from the peripheral ganglion to the brain and transmit the following two type of sensation: general sensation, which is referred to the sensation of pain, touch and temperature; special sensation, which include the perception of vision, smell, hearing and taste. Now go to the motor or efferent nerve. Those nerves send impulse from the brain and spinal cord to all the muscles of the body, which initiated muscular movement. The neuron involved can be either an upper or a lower motor. Upper motor neuron refer to a nerve cell that connect the brain into spinal cord, and the cell body of the upper motor neuron is located in the motor area of cerebral cortex, and it processes connect with the lower motor neuron. Lesson of upper and lower motor neuron. Lower motor neuron is referred to a nerve cell that connect the spinal cord to a muscles. The cell body of a lower motor neuron is located in the spinal cord, and its termination is in a skeletal muscles. Lesions of lower motor neuron result in weakness, twisting of muscles and loss of muscle mass. Mixed nerve. Those nerves carry both sensory and motor fiber. Those are called mixed nerve. Secretomotor nerve. Those are efferent nerves with the ability to induce a gland to secrete a substance. For example, the lacrimal branch of maxillary nerve supplied secretomotor innervation to the lacrimal gland, stimulating its secretion of tears. On the basis of control over system, somatic nervous system autonomic nervous system. Somatic nervous system is a part of nervous system that perceives stimuli from the external environment and the control voluntary activity of the body. For example, movement of limbs by action of skeletal muscles. Autonomic nervous system. Autonomic nervous system is the part of the nervous system that control involuntary action. For example, functioning of internal organ such as heart, intestine. It is a subdivide into the sympathetic nervous system and parasympathetic nervous system. The action of those two systems oppose each other. The sympathetic nervous system is the part of autonomic nervous system that emerges from the thoracic and lumbar region of spinal cord. Action are varied depending on the organ involved. The sympathetic nervous system is active during emergency situations. The parasympathetic nervous system. It is the part of autonomic nervous system that arises from brainstem and sacral part of the spinal cord. The action of this system oppose the action of sympathetic system. Both somatic and autonomic nervous system have sensory as well as motor components. On the basis of presence of myelinated nerves. Those are nerves which myelin sheet and their conduction velocity is faster than that of the non-myelinated nerves. Myelin is formed by Schwann cell and in PNS and oligodendrocytes in central nervous system. Non-myelinated nerves. Those are nerves without myelin sheet. On the basis of diameters, the nerves may be classified on the basis of their diameters, which according to the degree of the myelination. most myelinated are called A alpha, then A beta, then A delta, A, B, C. Those are follows. This is not also most important. On the basis of the functional components of nerves. Somatic efferent nerve fibers. Those are fibers which transmit motor impulse from the spinal cord to skeletal system. Visceral efferent nerve fibers. Those are the fibers which transmit motor impulse from the spinal cord to the smooth muscles, cardiac muscles and gland. Somatic afferent nerves fibers. Those are fibers which transmitted exteroceptive and proprioceptive impulse from the body to spinal cord. Visceral efferent nerve. Those are fibers which transmit interoceptive impulse from the viscera to spinal cord. Now go to the details of autonomic nervous system. The autonomic nervous system controls involuntary action of the body. Autonomic nervous system has two main components, sympathetic and parasympathetic system, which work in the opposition to each other to the maintains the hemostasis of the body. Their actions, whether excitatory or inhibitory, depends on the organ involved. The difference are the very common, and sympathetic and parasympathetic are opposite functions. Now go to the sympathetic nerves of the head. The sympathetic system is the part of the autonomous nervous system, autonomic nervous system that concerned with involuntary initiation of the functioning of internal organs. Characteristic features: the sympathetic system play a significant role of following. Those are: 1. Sympathetic system remain substantively active throughout the day as well as a night to be prepared for fight or flight response, to manage emergency and stressful situation. It opposes the actions of parasympathetic nervous system to maintain homeostasis. Origin: the sympathetic fibre originated from the thoracolumbar region of the spinal cord. Structures: two types of neurons are involved in the transmission of impulse to sympathetic system: preganglionic neurons, postganglionic neurons. Preganglionic neurons arise from intermediolateral horn of the thoracolumbar region of the spinal cord to reach a ganglion and to synapse with a postganglionic neuron present in the ganglion. Sympathetic ganglia are centers where the preganglionic neuron synapse with the postganglionic neuron. The sympathetic ganglia of head and neck are the cervical ganglia. The cell bodies of postganglionic neurons are present in the ganglion and their action extends to target organ such as viscera, blood vessels or glands. Characteristically, the postganglionic action are longer than preganglionic action. Action of sympathetic nerves exit the spinal cord through the anterior root. They run adjacent to the spinal or sensory ganglion and enter the anterior rami of spinal nerves. Later they join either the paravertebral or prevertebral ganglia through the communicating rami. Neurotransmitter: adrenaline and noradrenaline are the neurotransmitter involved in the nerve ending of the sympathetic nerve. Action: the stimulation of sympathetic nervous system result in a number of responses that are varied system-wise. They are follows. 1 is constriction of blood vessels supplying the skin, dilation of blood vessels supplying the heart and skeletal muscle, bronchial dilation, release of glucose from the liver. Sympathetic ganglia. Ganglia of sympathetic nervous system are called sympathetic ganglia. Two groups of ganglia are identified on the basis of their location within the body. Paravertebral and prevertebral ganglia. One is paravertebral ganglia. Those are located on either side of the vertebra and are united to from the sympathetic chain or trunk. Normally 21 or 22 pairs of those ganglia consist the sympathetic trunk and are found along the entire length of the vertebral column. 3 in cervical region, 10 to 11 in thoracic region, 4 in lumbar region, 4 in sacral region, and a single unpaired ganglion in front of the coccyx. Second is prevertebral ganglia. Those are lying in the front of the aorta and are 3 in number: coeliac, superior mesenteric, inferior mesenteric. Now go to the parasympathetic nerves of head. The parasympathetic system is responsible for the function of the body at rest, such as digestion, salivation, sexual arousal, lacrimation, urination, and defecation. Characteristic features: the parasympathetic system exerts its effect predominantly during non-emergency situations such as digestion and rest. In general, its function opposes the action of sympathetic system. Origin: the parasympathetic fibers arise from a source called craniosacral outflow. Cranial nerves: 3rd, 7th, and 9th. Second, sacral segment of spinal cord. S2, S3, and S4 spinal nerve, especially the ventral horn. The parasympathetic nerves, which originated from S2, S3, S4 spinal nerve, called the pelvic splanchnic nerve or the nervi ergates. Neurotransmitter: acetylcholine is the neurotransmitter at the parasympathetic nerve ending. Parasympathetic ganglia. Parasympathetic ganglia are the autonomic ganglia of the parasympathetic nervous system. They lie close to or within the organs they innervate and hence called intramural ganglia. The parasympathetic ganglia of the head and neck region, however, are exception to this. 4-pair ganglia supply all the essential parasympathetic innervation to the head and neck area. The parasympathetic ganglia and their innervation are as follows. One is cerebral ganglion, pterygopalatine ganglion, submandibular ganglion, octave ganglion. Structure of ganglion: every parasympathetic ganglion consists of 3 roots which enter the ganglion and have multiple extinct branches. The 3 roots are follows. motor root, sensory root, and sympathetic root. Motor root. This is carries presynaptic parasympathetic nerve fiber. Those fibers terminate in the ganglion and synapse, with the sympathetic fibers traveling to the target organ. Sensory root. Sensory root carries general sensory fibers. Those fibers do not synapse in ganglion. Sympathetic root. This carries sympathetic post-synaptic sympathetic fibers. Those fibers also pass through the ganglion without synapsing. Some ganglion also carrying special sensory fibers that transmit the taste sensation. All the four parasympathetic ganglion of the head receive sensory filaments from the trigeminal nerve and motor and sympathetic filament from various sources. Now go to the spinal nerves. The nerves which emerge from segment of the spinal cord, those are called spinal nerves. The spinal nerves form the part of the peripheral nervous system. In human, those are 31 pairs of spinal nerve. 8 is cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 is coaxial. It should be remembered that the number of vertebrae at the every level follows the 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coaxial. The number of spinal nerves generally correspond to the number of vertebrae, except in the cervical region. This is because in the cervical region, spinal nerve root comes out above the corresponding vertebrae. Therefore, the spinal nerve that lies between the skull and the first cervical vertebra is the first spinal nerve. From the thoracic to coaxial region, the spinal nerve root emerges below the corresponding vertebra. For example, spinal nerve T1 is arises below the thoracic vertebra T1. Formation. A spinal nerve formed at the intervertebral foramen by the union of the anterior and posterior root that arise from the spinal cord. The anterior root contain the following structures. One is motor fibers of skeletal muscles, sympathetic fiber, parasympathetic fiber, and posterior root contain sensory fibers, whose cell body are the spinal ganglion. Branch of spinal nerve. After its formation, the spinal nerve subdivide to the give rise to the branch are listed. The branches are called the rami, singular ramas. One is anterior branch or anterior primary ramas. This is larger than the others branch. It innervate the anterior as well as the lateral part of the body and limbs. The great nerve plexus, namely the cervical, brachial, lumbar, and sacral plexus, are formed by the anterior rami The cervical plexus of relevance to the face. Posterior branch and or posterior primary ramus. This is the innervates the back of the trunk. Communicating branch. This is the connect the spinal nerve to the sympathetic trunk. Meningeal branch. This is the branch supplied the dura mater by re-entering the vertebral canal through the vertebral foramen. Cervical spinal nerve. Cervical plexus. The cervical plexus is formed by the first four cervical nerves C1, C2, C3, C4. This is the network divides and recombinates to the create a variety of nerves that supply the skin and the muscles of the neck and back of the head. Origin. The plexus is formed by the anterior rami of C1 to C4 spinal nerves. Location. The plexus lies anterior to the origin of levator scapulae and the scalenus medius muscles and deep to the superior part of the sternocleidomastoid muscles. Branches. The various branches arise from the cervical plexus. One is cutaneous branch and second is muscular branch and third is brachial plexus. One, cutaneous branch. Those branch provide the sensory innervation to the skin. Arises at the level of medial third of the sternocleidomastoid at the posterior border to innervate the skin of the neck and scapulae between the auricle and the external occipital protuberance. The branch and the region innervated by them as follows: lesser occipital nerve C2 and C3, skin of the occipital region behind the ear; greater auricular nerve C2 C3, skin over the mastoid auricle, angle of the jaw over the parotid and mesenteric area; transverse nerve of neck, skin over the anterior aspect of the neck; supraclavicular nerve, skin over the acromion and deltoid pectoral region. Muscular branch. One is suboccipital nerve C1, supply the deep muscle of neck; phrenic nerve anterior rami of C3 to C5, supplied the diaphragm. Third is brachial plexus C5 to T1. This is the plexus is formed by the last four cervical spinal nerves C5, C6, C7, C8 and first thoracic spinal nerve T1. This network formed the nerve which innervate the arm and upper back. Cranial nerves. Cranial nerves originate directly from the brain. They reach the head and the neck region by transversing through the numerous foramina present in the base of the cranium. There are 12 pairs of cranial nerve in all, each digested by a Roman numeral. The numbers indicate the arrangement of the nerves from the anterior to the posterior direction. The first and second pair arise from the cerebral, whereas the remaining 10 pairs originated from the brainstem. The cranial nerves may be motor, sensory, or mixed. Origin of cranial nerves. In general, the fibers of the motor nerves originate from a group of nerve cells in the brain called nuclei, and the fibers of sensory nerves originated from a group of nerve cells outside the brain. The nerves are named as follows: 1 is olfactory, 2 optic, 3 oculomotor, 4 trochlear, 5 trigeminal, 6 abducens, 7 facial, 8 acoustic, 9 glossopharyngeal, 10 vagus, 11 accessory, 12 hypoglossal. The function of cranial nerve have been summarized in next lectures. Now the today lecture is finished with the basic and the details about the nerves, and in next lectures of this chapter is coming soon, and in next lectures we are details discussed about these 12 pair nerves. Thank you.